the briefing on the City of Philadelphia's response to COVID-19. Today, all of our speakers are joining the briefing virtually to adhere to social distancing guidelines. We will now begin our briefing with opening remarks from Mayor Jim Kenney. Mayor, you have the floor.
Good afternoon. Since the start of this pandemic, we have been acutely aware of its impact it is having on seniors. I would like to spend a few minutes talking about another serious topic that the pandemic has exacerbated, and that's elder abuse. In this time of isolation and social distancing, our elderly residents are even more susceptible to becoming the victims of bad people. June is World Elder Abuse Awareness Month, so it provides an opportunity for us to raise awareness about elder abuse, neglect, and exploitation. Elder abuse is a legal crisis, a public health crisis, and a human rights crisis, both here in Philadelphia and around the world. Millions of older Americans face devastating violence and physical, emotional, and financial abuse. They lose billions of dollars annually due to elder financial abuse and exploitation, funds that could be used to pay for basic needs such as housing, food, and medical care. Unfortunately, it occurs in every demographic and can happen to anyone, a family member, a neighbor, even yourself. It is estimated that only 1 in 14 cases of abuse are reported to authorities. A Philadelphia's population of nearly 1.6 million people, nearly 1 in 5 are over the age of 60, and half of those older Philadelphians live near or below the federal poverty level. Older adult protective services in Philadelphia investigated over 4,300 reports of suspected abuse, neglect, and financial exploitation last year. Many organizations in Philadelphia are engaged in the discovery, prosecution, and elimination of elder abuse in our community. These include the Philadelphia Corporation for Aging, Philadelphia Financial Exploitation Prevention Task Force, the Senior Law Center, Philadelphia Bar Association, CARI, the Center for Rights and Interest of the Elderly, and the Elder Justice and Civil Resource Center of the 1st Judicial District of Pennsylvania. But there is so much more to be done. So please join me today and every day in voicing your opposition to the abuse, neglect, and exploitation of older Philadelphians. And now I'd like to turn it over to Dr. Farley for his COVID update.
Thanks very much, Mayor. I have mostly good news to talk about today, but I do have some concerns I want to talk about. We've been in the yellow phase now for 11 days, and there are many positive signs with the data we're looking at. So here are the numbers. Since this time yesterday, there have been 116 new cases of the coronavirus infection in Philadelphia residents, bringing us to a total of 24,591 since the beginning of the epidemic. Now, the daily number is above 100 cases, but we are testing more people. A little background on the testing numbers. Before the protests, we were testing nearly 1,900 people per day. During the week of the protest, that number dropped to about 1,500 per day. Last week, we were back up to 1,790 per day. And results I'm reporting today are based on 2,000 results. So the amount of testing we're doing has bounced up. And that number of new cases divided by the number of tests we received means that less than 6% were positive. And that's at an all-time low. So the fact that the number is above 100 really is more reflective of the fact we're doing more testing than we're seeing an increase in the number of transmissions of the infection. The number of people seen in hospital emergency departments for symptoms that are similar with the coronavirus infection is still very low. So overall, we're saying so far there's no evidence of increased spread as a result of the protests, and that's a very good thing. As far as our hospitals, as of this morning, we had 276 people with the coronavirus infection in Philadelphia hospitals and 481 in the hospitals in the Southeast Pennsylvania region. Those numbers are nearly 75% below the peak that we reached at the worst of the epidemic. In our nursing homes, we're seeing much reduced spread. We're getting about 1 to 2 cases per day, and all the nursing homes combined across the entire city, that's 47 nursing homes. That's a very good thing. We would like that number to be 0, though. As far as deaths, I do have to report 21 new deaths today. That is not the number of deaths that have occurred today. That's the number of deaths that come to our awareness today. We periodically match our database against other databases, and we pick up deaths that have occurred in the past. The total number of deaths since the beginning of the epidemic is 1,495. But in the past few days, we're talking about a few deaths per day. Of those total deaths, 768, or 51%, are nursing home residents. I talk a little bit about testing. Testing is something we are now very strongly encouraging, and the number of testing sites across the city is increased, and so testing has never been more available. The sites that closed down during the protest have reopened, or there's one that is about to reopen. I count a total of 56 sites across the city right now. You can get information about all those sites at www.phila.gov/testing. We're recommending testing for anyone with symptoms of respiratory symptoms, or anybody who believes that they were exposed to coronavirus infection, or believe that they may have been exposed to this infection. Now, we are in the yellow phase, as I said earlier. I just want to remind people, this is an increased risk as people restart these activities. And we have some very clear rules for how we want people to operate so that we don't have an increased risk of spread as activities restart. We're calling that our safe mode. And for each activity, there's a safety checklist. And the checklist includes 8 items, regardless of what activity we're talking about. Those include masks, barriers, distance, keeping people 6 feet apart, reducing crowds, isolating people, that is identifying people who might have symptoms and having them not be present so they can't spread to others, hand washing, environmental cleaning, and communicating the rules to everybody. I want to remind people about that, and there is specific guidance to different activities on our Safer at Home webpage. I do want to talk specifically about outdoor dining. This is an area of concern. That began last Friday, June 12th. And I did receive reports of restaurants and bars with outdoor dining not following the guidance. And in fact, I saw this myself. There were people seated less than 6 feet apart. That's to say, people at different tables, but less than 6 feet apart. There are people in crowds, people talking in crowds, not wearing masks. Now, I understand the restaurants have been hit very hard with this crisis. And the city wants to help those restaurants. We want to help them restart. We want them to help them start making money again and start employing people. But there's still, what I saw and what I heard has me very concerned. While outdoor exposures are less risky than indoor exposures, certainly the virus can spread among people when they're close together and not wearing masks. When you have a crowd of people, it increases the risk that any one person may have the infection and may be spreading it. And it increases the number of people within range of that person who may be spreading it. So what my real concern is if people are not following the rules now in restaurants outdoors, will they follow them when restaurant indoor dining is allowed, where that's an even higher risk situation? So whenever to remember, despite the progress we're seeing in the numbers here, that the virus hasn't changed, that human biology hasn't changed. And so Philadelphia is just as vulnerable to an epidemic wave now in June as it was in March. Now, there are many other states in the United States that are seeing increases in cases, and the US as a whole is seeing increases. So I want to be clear to everyone, this epidemic isn't over. Far from it. Until we have a vaccine, the only thing that's protecting us is how we behave. So we will be enforcing the rules for these restaurants that have outdoor dining. We will have our sanitarians visit those restaurants and issuing warnings. If the restaurants refuse to follow the rules, we will cease the operations of those restaurants. But everyone needs to help in this. So my message to residents now is if you go to a restaurant with outdoor dining and you see that people are not doing social distancing, don't eat there. Don't give them your business. And call 311, and we will have a sanitarian visit that restaurant and issue the warning. To restaurant managers, my message is if you don't follow the rules, this may end up delaying going to indoor dining. And it could be that we will have to shut down the outdoor dining. We've made so much progress. Let's not lose everything we've gained at this point. So we're asking everyone, regardless of what activity you're involved in, to just follow the safety checklist. It's all on www.phila.gov/safer-at-home. For individuals, rules are pretty simple. Masks, distance, hand washing. Thanks very much.
Thank you, Dr. Farley. We're now going to move to Armando's remarks, who will be delivering a Spanish translation of both the mayor and Dr. Farley.
Mensaje del alcalde Jim Kenney para el 16 de junio del 2020. Buenas tardes a todos. Desde el comienzo de esta pandemia hemos sido muy conscientes del impacto que ha tenido en todos nuestros residentes, pero especialmente para las personas mayores. Por eso me gustaría hablarles sobre otro tema muy serio que la pandemia ha exacerbado, y es el abuso de los ancianos. En estos momentos de aislamiento y distanciamiento social, nuestros residentes mayores son aún más susceptibles a ser victimizados por personas inescrupulosas. Junio es el mes mundial de la concientización sobre el abuso de los ancianos, lo que me brinda la oportunidad de hablarles sobre la importancia de crear conciencia sobre el abuso, el abandono y la explotación de los ancianos. El abuso de ancianos es una crisis de salud pública y una crisis de derechos humanos, tanto aquí en Filadelfia como en todo el mundo. Millones de estadounidenses mayores enfrentan abuso físico, emocional y financiero. Ellos, nuestros residentes mayores, pierden anualmente miles de millones de dólares debido al abuso y la explotación financiera, dinero que ellos podrían usar para pagar necesidades básicas como vivienda, alimentos y atención médica. Desafortunadamente, esto ocurre en todos los grupos demográficos y puede sucederle a cualquiera, a un miembro de su familia, a un vecino, incluso a usted mismo. Se estima que solo 1 de cada 14 casos de abuso se denuncian a las autoridades. De casi 1.600.000 personas que viven en Filadelfia, 1 de cada 5 ciudadanos tiene más de 60 años y desafortunadamente la mitad de la población de adultos mayores de Filadelfia vive muy cerca o por debajo del nivel federal de la pobreza. Los servicios de protección para adultos mayores en Filadelfia investigaron el año pasado más de 4.300 informes de sospechas de abuso, negligencia y explotación financiera. Queremos decirles a nuestros adultos mayores que no están solos. Muchas organizaciones en Filadelfia se dedican a la investigación y penalización del abuso de ancianos en nuestra comunidad. Entre las mismas podemos mencionar las siguientes organizaciones: la Corporación de Filadelfia para el Envejecimiento, The Philadelphia Corporation for Aging, el Grupo de Trabajo para la Prevención de la Explotación Financiera de Filadelfia, el Centro Senior Law, el Colegio de Abogados de Filadelfia, CARI, el Centro de Derechos e Intereses de las Personas Mayores, y el Centro de Justicia Civil y Recursos Civiles del Primer Distrito Judicial de Pensilvania. Juntos podemos hacer mucho más por nuestros adultos mayores. Hoy y todos los días debemos expresar nuestra oposición al abuso, negligencia y explotación de los adultos mayores de Filadelfia. Y esta es la actualización en materia de salud para el martes 16 de junio del 2020. Buenas tardes. En general, hoy traigo buenas noticias. Vemos un retroceso en la epidemia y un progreso sostenido. Desde ayer se han confirmado 116 casos del coronavirus en Filadelfia y actualmente tenemos un total de 24.591 casos en la ciudad. Estos son los resultados de 2.063 pruebas que recibimos el día de hoy, lo cual representa menos del 6% de casos positivos del total de pruebas recibidas. Esto es un gran progreso. 276 personas están hospitalizadas por el COVID-19 en Filadelfia y 481 personas en la región sureste de Pensilvania, incluyendo el condado de Filadelfia. Estamos por debajo del 75% de la curva en estos momentos. Los casos en los hogares de ancianos también han disminuido y reportamos de 1 a 2 casos diarios entre los 47 hogares de ancianos de la ciudad. Pero lamentablemente también reportamos 21 fallecimientos por la COVID-19 en la ciudad. Un total de 1.495 personas han muerto por la COVID-19. Este número tan elevado de muertes corresponde al cruce entre las bases de datos locales y estatales, donde la causa de la muerte no había sido atribuida al COVID-19. 768 o el 51% de estas muertes han sido en hogares de ancianos. Con respecto a los centros de pruebas, están disponibles en todas sus ubicaciones en la ciudad. Usted puede encontrar los centros de pruebas más cercanos a su domicilio en fila.gov/testing. Nos encontramos ya en la fase amarilla, por lo tanto vamos a promover y exigir el uso de una lista de verificación de seguridad para los comercios que incluye el uso de máscaras o cobertores faciales en los establecimientos comerciales, la instalación de barreras de plexiglas, el mantener la distancia social en todo momento, el aislamiento cuando sea necesario, el lavado de manos frecuente, la limpieza exhaustiva de las superficies y los locales comerciales en general, una comunicación clara y eficaz con el público. El servicio de comidas al aire libre comenzó el pasado viernes 12 de junio. Hemos recibido informes de restaurantes y bares que no están observando las directrices. Hay personas sentadas a menos de 6 pies o 2 metros de distancia. Hay multitudes que no están usando máscaras o cubiertas faciales. Entendemos que la pandemia ha golpeado fuertemente a los restaurantes y la ciudad quiere ayudarles a recomenzar, pero estamos muy preocupados. A pesar que el servicio de comidas al aire libre representa menos riesgo, el virus aún se puede propagar si las personas no usan máscaras faciales cuando no pueden mantener la distancia social. Respecto a las congregaciones y multitudes, pueden aumentar el riesgo de transmisión de persona a persona. Si no seguimos las normas en este momento, ¿Vamos a seguirlas cuando se permita el servicio regular en los restaurantes? Recordemos que a pesar del progreso, el virus no ha desaparecido. Filadelfia se encuentra tan vulnerable ahora como lo estaba en marzo. Muchos otros estados han visto un incremento de los casos y en los Estados Unidos en general ha habido un aumento en los casos. Esta epidemia no ha terminado y estamos muy lejos de que termine. Hasta que tengamos una vacuna, la única protección es nuestra conducta. Y haremos cumplir las normas. Visitaremos los establecimientos, aplicaremos la ley y en algunos casos obligaremos al cese de operaciones. Por lo tanto, todos necesitamos ayudar. A los residentes, si el restaurante no cumple con la distancia social, por favor, no lo visite. Llame al 311 para denunciar esta infracción. A los dueños y gerentes de restaurantes, si no observan las normas, vamos a retrasar la autorización del servicio regular y probablemente tengamos que finalizar el servicio de comidas al aire libre. Hemos avanzado mucho, pero por favor no perdamos todo lo que hemos ganado hasta este momento. A todas las personas que tengan negocios, les pedimos encarecidamente cumplir con las medidas de seguridad. El uso de las máscaras, el mantener siempre la distancia social, el lavarse las manos frecuentemente, y usted puede obtener mayor información sobre estas normas y otras visitando fila.gov/safer at home. Con su ayuda y la nuestra, podremos superar este gran reto. Muchas gracias.
Thank you, Armando. We will now move to the Q&A portion for members of the media. We ask that you please limit your questions to topics related to COVID-19. If time permits, we will open the floor later to other topics. So if you have your hand raised now for another topic, please lower it and we will try to get to that at the end. And please remember, we do have limited time during these briefings, so only one representative from each outlet is permitted to ask questions. Reporters are asked to limit their questions to 3 or fewer. And again, we will do a second round of questions if time permits. For those logged in today, please use the raise your hand feature. It can be found under the participants list. We also ask that you use video to ask your question if you are able. And we'll now start by unmuting reporters one by one to ask your questions. Please limit this to COVID questions only, and we will start with Mitch Blocker of NBC 10.
Good afternoon. Mr. Mayor, Dr. Farley, I'm wondering, are you concerned about the spread of COVID-19 in the camp growing near 22nd and the Parkway?
Doctor?
Yeah, I would be concerned about any crowd where there are people together. I don't know how many people are in that particular facility. Any crowd where there are people together not wearing masks, I'm concerned about.
What services is the city offering to curb the spread of COVID-19 to that group?
There's nothing specific to that group. My understanding is that group has requested that city services not be provided on site.
Is public health a consideration in terms of breaking up the camp?
Public health is a consideration, but as far as breaking up a camp, I'm going to have to defer that question to other people.
Mr. Mayor, do you have a comment?
I mean, obviously, we have concerns about health there. When anytime people congregate, live inside, don't have extensive bathroom facilities and are congregant together in a time of a pandemic. Yeah, I mean, it's all consideration. I mean, we've offered substantial services to individuals there who are unsheltered. Our folks have been shunned away or scooted away by the organizers of the event, of the protest. While we recognize it is a protest, we have beds available. We have services available for people who are unsheltered. And we would like to avail them of those services. But we'll continue to monitor the situation and make a decision. It's not going to last forever.
Thank you, sir.
Thanks, Mitch. We're going to go now to Shaira Arias of Telemundo.
Let me see. Can you hear me?
Yep.
Yeah.
Hola, Shaira.
No sé si se ve. Hola, Armando. La pregunta es un poco basada en lo que Mitch Blocker acabó de preguntar, en cuanto a que acaban de mencionar que hay una disminución drástica en los casos, está la ciudad de buen humor en cuanto a lo que viene siendo los casos de COVID-19 y que ahora hay 100 personas y puede ser que continúe creciendo la cantidad de personas que están aglomeradas viviendo en el campamento aquí en la calle 21 con el Benjamin Parkway. ¿Qué tanta urgencia tiene la ciudad para poder negociar con los activistas que están organizando esto debido a la pandemia del COVID-19? Y que puede ser que eso básicamente presenta un riesgo de salud para los que están aquí y personas que están caminando.
Y la pregunta es, ¿qué va a hacer la ciudad para negociar la salida, el cierre?
Sí, porque déjales saber a ellos que ellos me dicen que no saben cuántas personas están viviendo aquí. Nosotros estamos al frente de ellos. Hay 100 personas, pero está creciendo. Entonces, en medio de que esto está creciendo, los casos de COVID-19 están disminuyendo. ¿Qué urgencia tienen ellos para poder negociar con ellos debido a la pandemia que estamos viviendo actualmente?
Muy bien, gracias, Shaira. The question may be for both Mayor and Dr. Farley. Picking up on what Mitch asked just now, there's a drastic reduction in the cases in the city for the COVID-19. However, this is in connection with an encampment at the Parkway and 21st. There's 100 people there now and growing. And is there any urgency on the part of the city to negotiate with the encampment because of the health risks that this may pose to the city, as there are greater numbers of people accumulating there? Is this an issue where you're going to be negotiating a solution to this?
We've been in contact with them as regularly as we can when they're open to talking. We've been trying to engage individual unsheltered folks to offer the services, and have been kind of intercepted or interrupted by the people organizing the event or the protest. We'll continue to do that and continue to evaluate the situation, and at some point in time make a decision which is in the best interest of the health and safety of everyone involved.
Bueno, hemos estado en contacto con ellos de forma regular. Hemos estado y estamos abiertos a conversar con ellos. Nosotros hemos tratado de participar de lo que ellos están haciendo. Les hemos ofrecido servicios, pero la gente que está organizando esto no les ha permitido acceder a ellos. Vamos a continuando evaluando la situación para tomar una decisión con respecto a un tema que es últimamente de salud pública.
Okay, that's it. Thank you, Armando. Thank you.
Gracias, Shaira. Thank you.
Thank you. We're going to go now to Pat Loeb of KYW.
Dr. Farley, this was actually something Councilman O observed yesterday. When you find that there was no increase in cases because of the protests, and you saw thousands of people gathered together, many of them not social distancing and not wearing masks, it makes people cynical about taking these steps, was his opinion. And I can see why he would think that. Do you see why people would have a hard time feeling a sense of urgency about staying 6 feet apart in an outdoor restaurant after the results of the protests found no increase in cases?
Sure, I can understand why anybody who hasn't been personally affected by this may feel like, why should they worry? But let's remember, close to 1,500 people have died with this epidemic. Close to 1,500 Philadelphia residents have died in this epidemic. May not be you, may not be your friend, but that's how many people died from this epidemic. And our ability to control this epidemic wave really relies on everybody following this. So I can understand why some people would be skeptical, but I'm pleading with people to take these guidelines seriously. If they don't, and we can't control it all, we will see another epidemic wave, and we will see many more deaths.
So you don't think the fact that there were no increase in cases from thousands of people joining together, many without masks, many more closer than 6 feet apart, would make people question how the need to do that?
Well, I mean, just say in the protest, what I observed was that most people were wearing masks and most people were keeping a distance. So I take the alternative conclusion from that, and that is that people follow the rules. We can do an awful lot of activities safely, but people need to follow the rules. If they're standing next to each other and not wearing a mask, that's a very different situation.
Okay, thank you.
Thank you, Pat. We're going to go now to Jack Tomczyk of Metro.
Yes, my question is about the restaurants. how many restaurants or bars have been cited and closed down since outdoor dining opened last week?
I don't believe that we have closed any down, and I know that we have our staff have visited some, but this is new, a newly recognized problem. So we're going to be seeing more of that in the coming days and weeks.
All right, thank you. That was my only question.
Thanks, Jack. We're going to go to Manuel Smith of CBS 3.
Dr. Farley, there was another follow-up question to that too. So no specific number of visits that the health sanitarians have made to restaurants, or any way we can quantify the increase in visits because of restaurants not following COVID-19 restrictions?
No. So I can get you some data and follow up on the number of visits we've made in response to complaints. I don't know that we can pull it separately about what the type of complaint is and what was done there. We can get you some information on that and follow up.
All right, no problem. We will follow up. And then there's been some new modeling today that's come out that said, hey, there's more than 200,000 people that could die in the U.S. by October 1st because of COVID-19. Just wanted to get your candid thoughts on that, and how you're feeling given the positive data trends that we're seeing here in the city compared to the other data, or to those models.
I have not seen that model, but I find it entirely possible that we could reach that many. We're somewhere around 110,000 deaths in the United States right now. And I want to point out again, and we're seeing rising cases in many states that don't have any restrictions right now. And I think that's a big mistake. They're going to see many more cases. They're going to be seeing many more deaths. That's entirely plausible. It seems to be people have tired of the epidemic, but the virus is not tired of us. There's still plenty of susceptible people out there for the virus to infect. So whereas people were maybe too worried before, now they're not worried enough. And so we need to remind people how serious this infection can be.
Got it. Thank you.
Thanks, Manny. We're going to go now to Argenis Figueroa with Univision.
Good afternoon. Everyone. Buenas tardes, Armando.
Buenas tardes.
Okay, tengo dos preguntas para el Dr. Farley. La primera de ellas sería si maneja alguna información, si ha bajado el índice de vacunación en los niños de la ciudad durante esta pandemia, y si es así, si es afirmativo que ha bajado el índice, esto pudiera ser una preocupación para las autoridades. Y la segunda pregunta sería qué mensaje le enviaría a aquellas personas que temen llevar a sus hijos a vacunar por temor a un contagio.
Argenis, te refieres a las vacunas infantiles, ¿verdad?
Sí, vacunas infantiles, sí.
Bien. The question for Dr. Farley is a two-part question. The first one is if you have any information about the vaccination rate for children, if their numbers are down, and if this is a source of worrying for the city. And the second one that is connected with it is what message would you send to parents who are fearful of taking their children to getting them vaccinated?
Thanks for asking those questions. We are concerned that the number of children getting vaccinated, particularly the number of children between the 12 months and 18 months time period, that number has gone down. And those children are at risk for diseases that can be prevented by vaccines, such as measles. So we're strongly encouraging parents who have children that need vaccines to bring them into their pediatrician's office to get vaccinated. The medical offices have taken a number of precautions to make it safe. I do think it is safe, and it is far less safe to keep your child at home and have that child be unvaccinated.
Gracias por hacer esa pregunta. Efectivamente, nos preocupa el número de niños cuyos índices de vacunación ha caído, especialmente aquellos que tienen entre 12 a 18 meses de edad y que están en riesgos de contraer el sarampión, por ejemplo, entre otras enfermedades. Y nosotros alentamos a los padres a que lleven a sus niños a las oficinas de sus pediatras. Nosotros hemos tomado precauciones de ese lado, dando la información para que la visita sea una visita segura y no haya riesgos. Y el peor riesgo puede ser el contraer una enfermedad por no ser vacunado. Gracias.
Okay, muchas gracias, Armando. Es todo.
Gracias, Argenis. Thank you.
Okay, you're welcome.
All right. Thank you, Argenis. We're going to go to Denise Clay of the Philadelphia Sunday Sun.
Good afternoon, everyone. My first question is for either the mayor or Dr. Farley. I don't know who could answer it best. I know that if restaurants aren't observing the social distancing and other rules that are supposed to be in place to keep, folks from getting sick while outdoor dining, can be cited and possibly shut down. Are there any fines involved in that?
Yes, we do have the capability of fining restaurants up to $2,000 a day.
Okay. Do either of you know how many restaurants are currently open for outdoor dining?
I don't.
I don't have the number for you, but we can probably get that for you.
Okay, and also, and I guess this is either for the mayor or Brian Abernathy, if he's on the restaurants have a lot of experience. So I know something about how close to be from to be in outdoor dining. How many people have actually applied for that?
Great, you, Denise. Now we're going to go to Bethany with the Inquirer.
Just wanted to know for the restaurant situation, any kind of general idea that you can give us what guidelines?
Keep it away from people at other tables. You can be at the same table with your household members, less than 6 feet away, but you should be more than 6 feet away from people at other tables. It's that crowding that we're hearing about that's not being followed.
Thanks, Bethany. Did you have any other questions? Okay. Next, we're going to go to Martin Pratt of Philly YBN.
Can you hear me?
Yep.
Okay, thank you. This question is for Dr. Farley. Dr. Farley, do you have the racial breakdown of the folks that are that you've seen the increase of COVID cases?
I don't understand the question. We're not seeing an increase in COVID cases. What's the question?
Oh, okay. I thought I misunderstood you when you were saying that the uptick. Maybe I was reading the percentage that is going up by slightly by 7% of the number of cases presenting.
No, our numbers, our percent positive is been going down, and the number of cases is been, it fluctuates a little bit day to day, but overall it's been going down.
Okay. And the second question is regarding the businesses that are besides restaurants, for instance, co-working spaces and businesses like gyms and stuff. Will they be required to do anything special in the upcoming weeks to get ready to reopen?
Office-based businesses can be open now. We have our safety checklist for office-based businesses, and that would include co-working spaces. Gyms are not allowed to be open now. They would be allowed to open in the green phase, and there'll be very specific guidance for that as well.
Okay, thank you. That was it.
Thank you, Martin. We're going to move to the second round with Loren Make of NBC 10.
Hey, guys. My first question is regarding the statue, the Columbus statue at Kenny Plaza. Mayor Kenny, I think this is for you. If you could tell us sort of what, I know you put a statement out last night, but what is the timeline for making a decision on the future of that statue? And are you certain that the city has the legal right to do that? We heard something about some question about that was being raised.
We'll start with the last one first. My understanding is that the city does actually own the statue, that it was gifted by a group of people who had the statue moved, I think, from Fairmount Park to currently the main Fairmount Park to Marconi. There's no specific time frame. I mean, some guidance says 90 days. We're trying to do that before then. And boxing of the statue is being in agreement with people who tried to restrain us from in order to preserve it and to keep it safe. And that process has been employed in other Confederate statues around the South to make sure that no one defaces it. But I don't have an exact date. There's a meeting of the Art Commission in July. We may be trying to get it scheduled for there, but I have no feedback yet on whether or not that's done.
And so it's your understanding that the city does have the legal right to do it, but Are you in court about it now?
No, I think there was a group went and filed a restraining order thinking we were taking it out, just unilaterally, which we did not have an intention of doing. The Rizzo statue, on the other hand, the governor had issued an emergency declaration. The statue became the focal point of a lot of protest and people trying to set it on fire. And we were concerned about the municipal services building. So we decided, in the interest of public safety, to remove it. We removed it at night, clearly because there would have been 2,000, 3,000, 4,000 people there today. We wanted to avoid any kind of confrontation or injury. And that's not the case with the Columbus statue. There's not a emergency declaration in place. We will follow the process as we know it.
Okay. And then last thing, we've heard gotten reports about some possible nail salons being open on Washington Avenue. Do you know anything about that? And if that is the case, what's your message to them?
I don't know anything about it, but doctor, if you want to.
So salons are not allowed to be open in the yellow phase. And so people, if they know of any salon that's open, they should call 311, lodge a complaint, and a city inspector will go there and shut them down.
Thank you.
Okay.
Thanks, Loren. We're going to go now to Cheryl Spreitzer of 6ABC.
Hi, how are you? This question is for the mayor. I just wanted to see if I could get some reaction from you in regards to President Trump's executive order in which he signed today on policing.
I listened to it. It's not helpful. The setting is one of domination and power. So I don't think it's going to really help much. The database, if it's done right, may be helpful. But I think the overall message, as I interpret it, was to his base and not necessarily to the entire country.
Do you think that, he's saying as part of new credentialing, chokeholds will be banned except, quote, if an officer's life is at risk, and, quote, he's looking at new advanced and powerful, less lethal weapons to help prevent deadly interactions? How would, what do you make of that?
I mean, every day is an adventure with him. So I don't know what to make of it. I just think he speaks sometimes for the sake of hearing his own voice. So I think we have to take care of this on city levels, state levels. If the U.S. Congress wants to do something substantive, certainly we would recommend that. But I really don't. I try not to comment on the president.
And given that the police funding is not going to be in the next budget, how would something like a national database tracking police officers' movements work here in Philadelphia?
That I don't know, because I don't know how it's going to be set up. But the desire is that an officer who's had a disciplinary problem or an abuse problem and gets fired from one police department doesn't just show up at another police department without the background knowledge of why that person was dismissed or left their former job. I think that's pretty common sense.
Do you track that here now in Philly?
I don't know. Brian, do you know if we do? We do extensive background checks, I know for sure, but if you have anything to add, Brian?
Yeah, no, we do extensive background checks. I would say generally it's our officers who are going to other jurisdictions rather than us taking officers that have had issues in other jurisdictions, but we can certainly get back to you on the specifics of that background check.
That would be great. Thanks, Brian. That's it. Thanks so much, guys.
Thank you.
Thank you. We're going to go back to Manuel Smith of CBS 3.
Unmute there. So a couple of questions on the boxing of the statue down at Columbus, or the Columbus statue in the park. How much is that costing right now? And are there any additional details about, what department is taking it on? How many employees are down there?
I assume it's public property, and I don't know the amount of the cost. It is plywood. It's not necessarily that expensive. And we can get back to you on the number of workers, probably Department of Public Property.
All right, cool. There's been some confusion over the reassignment of the 1st District Police Captain down there, whether that was related to what happened over at the park, maybe over the weekend or back. Could you to bring us all up to date. It was also a kind of a connection to that too, and saying, hey, if that captain was removed because of that, why no moves in the 26th district where things went wrong, kind of with the Fishtown group?
That was a decision made by the police commissioner. I made sure that since I've been mayor for going on 5 years now, that I do not intercede and try to micromanage our departments. We ask very qualified people to run our departments, and I have confidence in their decision making. And that was commissioner's decision along with command staff, and that's the end of it.
All right, last question is about the, you guys released some new budget numbers yesterday. We understand that a budget deal could be imminent between the administration and council. Can you speak to that? And were there any agreements on new revenue or new taxes as part of that?
Well, I'm not going to talk about specifics relative to budget negotiations, but an agreement is hopefully is imminent because we have deadlines to meet relative to PICA and the end of the fiscal year. So we'll have something probably relatively soon. And I'm not at liberty to discuss it at the moment.
All right, thank you.
Manny, I just want to clarify real quick. It's the Department of Streets that are boxing the staff.
My bad, sorry.
That's okay.
Thank you. Sorry.
Thanks, Manny. We're going to go back to Jack Tomczyk with Metro.
Yes, just one follow-up.
Sure. Jack, we can't hear you if you're talking. Okay, Jack, I'll come back to you just one sec, see if you can get your audio worked out. We're going to go to Pat Loeb of KYW.
Thanks. I had a more general question about plans for the encampment on the Parkway. Is it just going to stay there? Will you allow people to continue to come and camp out there, or do you have some plan for what happens next?
We'll continue to monitor it and continue to have discussions with the organizers and continue to try to get people who are unsheltered into shelter. At some point in time, we'll have to assess the health and safety issues surrounding the encampment and make a decision based on what's good for the health and safety of everyone involved.
Okay, thank you.
Thanks, Pat. We're going to go back to Jack Tomczyk with Metro. Jack?
All right, sorry about that.
That's all right.
Yeah, so I just had one follow-up on the boxing of the Columbus statue. I know you said it's to protect the statue from damage, but is it also a way to diffuse the situation by kind of covering up an image that some people are finding offensive?
That was not the main intent, but if it has that result, that'll be fine too.
All right, thank you.
Thanks, Jack. Okay, seeing no further questions, that will be the end of today's briefing, and we will be back again on Thursday with a COVID update. Thank you all.